Hello, welcome to Dr. Sam's anatomy classes. Here I'm going to solve this question paper of anatomy of second terminal exam of MBBS 2022 batch held at Naraina Medical College and Research Center, Kanpur. There were two parts. This was part 1, which was a 50 marks, a 10 marks long clinical question, then 5 marks each for these short answer notes, which makes 20 marks, 2 marks ultra short questions, 5 such questions make 10 marks, and 10 MCQs. And then you have is anatomy part 2. This also was a similar pattern, having a long question of 10 marks, which was a clinical question, 5 marks, 4 short questions, which makes 20 marks, 2 marks ultra short questions, 5 such questions make 10 marks, and then 10 MCQs. This exam was held on 12th of June 2023. Okay, now I'm going to help you solve this question paper fast so that it may help you for your upcoming further exams. So this long question was: a 50-year-old woman complained of swelling in upper middle side of her right thigh when she cuffs. This means she has some weakness in the anterior abdominal wall through which there is a loop of hernia or hernial sacs protrudes on cuffing. So where is the swelling and why does it appears when she cuffs? Where is the swelling partly has already been mentioned in the question that it is present in the upper middle side of her right thigh. But you will have to specify what is the hidden location which is not mentioned in the question. And that means they're talking is about upper medial side of a right thigh. That's the location of femoral canal. Think about the weakness there. When they talk about female, that also is somewhat signifying that they're talking is about femoral hernia because that's common in females. And of course, when she cuffs, there is increase in intra-abdominal pressure. And due to that increase in intra-abdominal pressure, the viscera tries to protrude out through the weakness in the abdominal wall. And if she is a multi-gravid female, right, 50 years, right? So generally in multi-gravid females, the lower abdominal wall becomes loosened, especially the femoral ring, that's the upper margin of the femoral canal, that also widens up and becomes loosened. So there are very much chances of hernia to protrude out through that ring going down into the femoral canal. So loops of intestine gets pushed there, and that is called femoral hernia. You just have to be precise in answering these clinical questions. You need not write very much lengthy, long answers in this question. What is the position of the swelling in relation to pubic tubercle? So you know what they're talking is about. This is ASIs, this is pubic tubercle, pubic crest, pubic symphysis, right? And this is the inguinal ligament. Here it is the location of femoral ring, which actually is a part of femoral sheath. This is femoral ring. This is femoral canal. Here you find is femoral vein passing down to the intermediate compartment of the femoral sheath. This is femoral sheath. And through the lateral compartment, it is this femoral artery that descends down. Also, the femoral branch of genitofemoral nerve that perforates this and emerges out to supply the skin of the roof of femoral triangle. Here is the position of deep inguinal lymph node. This is deep inguinal lymph node, also called lymph node of Rosenmuller, lymph node of Cloquet. Now I'm drawing is another diagram to explain you about the hernia. This I taught you was the femoral ring, and here it is the femoral canal, right? And remember that medial to the pubic tubercle, there's pubic crest, and above to the pubic crest is a triangular opening. That's a superficial opening of the inguinal canal, and this is called superficial inguinal ring. The two crura, right and left crura, and there you find is intercrural ligament. This is something important which is being mentioned in the question, and this is pubic tubercle. So remember, if a hernia protrudes out through the superficial inguinal ring, that can be direct inguinal or indirect inguinal hernia. Both of them, they will protrude out medial to the pubic tubercle. So this is inguinal hernia. Its bulging is seen medial to the pubic tubercle on cuffing. And if you find hernia descending down like this, now this is femoral hernia. This will descend down lateral the pubic tubercle on cuffing through the femoral canal. So this you will find lateral to pubic tubercle. Okay. Later on, it'll pass through, it'll find a weakness here in the fascia lata that's called cribriform fascia. It might even bulge out through this, and then this concentric margin, it'll compress upon the sac, may cause strangulation to the hernial sac. There's a ligament here, concentric ligament found forming the medial boundary of the femoral ring. This ligament here is called lacunar ligament. And this lacunar ligament has another important point, that there is sometimes a course of abnormal obturator artery running above to this. That abnormal obturator artery is a branch of inferior epigastric artery which runs over to this lacunar ligament sometimes. So while cutting the lacunar ligament to release the hernia, a surgeon has to be cautious enough to check for this abnormal obturator artery. You can mention these few little points, they might fetch you some additional marks. So the position of swelling will be lateral to pubic tubercle. Then there was short answer questions where you have to write about gluteus maximus muscle, very important muscle, the largest muscle of the body, an anti-gravity muscle having a wide origin, wide insertion, gluteal tuberosity, few of the deeper fibers they insert there, then much of the superficial fibers they insert on the iliotibial tract, right? It's a very strong extensor of the hip joint, also a lateral rotator of the hip joint, and anti-gravity muscle also helps you stand up from a squatting position. You can also mention about the nerve supply, the actions, and of course it acts as a cushion while you sit down on rough surfaces. In talking about Guyon's canal syndrome, there is a detailed lecture, a well prepared lecture of video. I have uploaded the link. You can watch it from there. Then development of tongue is super important question from general embryology portion. So make sure you go through this topic before you go for the exam. Then internal structure of right atrium, super duper important question. Be prepared with this question before your exams. Then talking about ultra short questions, talking here is about typical intercostal nerve, very important question. I have made a video for this and I've uploaded the link to this. You can watch it from there. Cul-de-sac of pericardium, it's the oblique sac of pericardium seen in posterior relation to the left atrium, and the esophagus lies behind to this. So dilatation of the sac will press upon esophagus and can cause dysphagia. Cortical versus spongy bone. This is a question from general histology. Important question. Hervation system, trabecular system, all has to be mentioned here. Coronary sinus, again a very important question. The location of coronary sinus, the tributaries of coronary sinus has to be mentioned in this. Fibrous skeleton of heart, another very important question. I've made a video on this and have attached the link. You can watch this video on fibrous skeleton of heart from there. Now let's solve these multiple choice questions. Question number 1. In ulnar nerve injury above the elbow, sensory loss will be there at all of the following sites except medial side of forearm, little finger, medial side of palm, medial side of dorsum of hand. One way is you can watch the video I have attached regarding the ulnar nerve injuries. We have explained it in detail. Right now, just remember that ulnar nerve innervates the skin of the little finger plus medial side, medial half of ring finger. Little finger is also mentioned as pinky finger by some authors. So both on the dorsal and palmar surface of these 1.5 digits, then medial side of palm and medial side of the dorsum of hand, all this is supplied by ulnar nerve, and this is the only cutaneous innervation of the ulnar nerve. Remember this. Medial side of forearm is innervated by medial cutaneous nerve of forearm. a branch of the medial cord of brachial plexus? So the answer here is medial side of forearm. Question number 2. Which of the following is false regarding the growing end of long bones? Again, the better way is you can watch the entire video on the growing end of long bones. I've dashed the link. It's a well explained video. You will get to know a lot many facts if you watch the video. Right now, remember, they have asked is false regarding the growing end of long bones. So it is the bulkier end. It's correct. Matures earlier is wrong. It's opposite to the direction of nutritional foramen is correct. So remember the fact that the growing end of the long bones is first to appear and is last to fuse. Last to fuse means it does not matures earlier. It is the opposite end which matures earlier. So the answer here will be B. Question number 3. Which sentence is correct regarding oogenesis? There was this correct statement. Oogonium divides meiotically to form primary oocyte? No. Oogonium divides meiotically to form primary oocyte? No. Oogonium enlarges to form primary oocyte? Correct. Oogonium divides to form primary oocyte and first polar body is also wrong. So remember, oogonium simply enlarges to form a primary oocyte. Then this primary oocyte undergoes meiotic division, the first meiotic division to form the secondary oocyte plus a polar body. And this second meiotic division is going to be completed just before fertilization, right? So the answer here is C. Oogonium enlarges to form primary oocyte. Question number 4. Which of the following structures is not seen in a transverse cut section of thorax passing through the fifth thoracic vertebra? So talking about fifth thoracic vertebra means that talking is about a plane passing below the sternal angle, means passing through the upper portion of the inferior mediastinum. The options here are pulmonary trunk dividing into right and left pulmonary arteries. This you will find there. Trachea dividing into right and left principal bronchi. Of course, you will find it. Then arch of aorta. This you will find at the level of T4 thoracic vertebra. Thoracic duct crossing the spine anteriorly. Of course, it crosses from the right side to the left side of the spine while passing in front of the fifth thoracic vertebra at this level. Arch of aorta, the C, this you will not find at the level of T5. This is seen behind the lower half of manubrium, that is the level of T4. So the answer here is C. Question number 5. Saphenous nerve is a branch of lumbar plexus, L3, L4. Anterior division of femoral nerve. Both of them are wrong answers. Posterior division of femoral nerve is the correct answer. Anterior division of obturator nerve is also a wrong choice. So remember, saphenous nerve is the only cutaneous branch arising from the posterior division of femoral nerve. Answer is C, which continues to be a deep nerve until it's in the thigh. It becomes cutaneous when it perforates the deep fascia on the medial side of the transverse crease of the knee joint. And from there, it descends down subcutaneously on the medial side of the leg, crossing anterior to the medial malleolus and reaching to the ball of the greater toe. So that's the area of the distribution of saphenous nerve. Anteromedial side of the leg and the upper medial border of the foot up till the ball of the greater toe. And remember, saphenous nerve gives a branch to innervate the skin overlying the ligamentum patelli, and that's called the infrapatellar nerve, which is a branch from saphenous nerve. Question number 6. All can act as anti-gravity muscles except sartorius, gluteus maximus, quadriceps femoris, gastrocnemius, and soleus. For this, I'm making this diagram. This will help you remember for a long time. So when you sit in a squatting position, these three joints, the hip joint, the knee joint, the ankle joint, all these three joints are in a state of flexion. Especially the hip joint and the knee joint, they're in a state of complete flexion. And your entire body weight is acting down towards the gravity. So when you have to stand up, there is no strings to pull you up. only these muscles, the anti-gravity muscles, will help you to stand up against gravity. So the muscles which will be extending these joints, they will be acting as an anti-gravity muscles. So remember, to open up or to extend your hip joint, you need this muscle called gluteus maximus. Similarly, to extend the knee joint, you need to have this muscle called quadriceps femoral. And to plantar flex the ankle joint, you need to contract this muscle gastrosoleus. So all these three muscles, they will help you stand up against gravity. However, sartorius, actually, remember, it's a tailor sit muscle, also called as honeymoon's muscle. It helps to make you sit down, right? Flexing the knee joint and the hip joint, and also laterally rotating the thighs. So remember that sartorius here is the answer. Question number 7. Due to injury to nerve root L5, S1, S2, S3, there will be sensory loss on all the areas of the lower limb given below except back of thigh, medial side of thigh, lateral side of leg, lateral side of sole. This diagram I'm drawing to show you the flow of dermatomes in the lower limb. So remember, the dermatomes flow from pre-axial to post-axial border, same as in upper limb. But the upper limb, the pre-axial border becomes the lateral border and post-axial border becomes the medial border. Similarly here in the lower limbs, because of the medial rotation of the limb buds, the preaxial border becomes the medial border and postaxial border becomes the lateral border. So dermatomes will flow like this: L1, L2, L3, L4, L5, S1, S2, S3. This is the flow of dermatomes in the lower limb. S3 will converge back towards the perianal region, right? So the answer here will be medial side of the thigh. Question number 8. Which of the following structures is not seen in the transverse cut section of the thorax passing through the third thoracic vertebra? Third thoracic vertebra means we're talking is about the upper portion of the superior mediastinum, means structures lying in posterior relation to the upper half of the manubrium. So there you will find is right and left brachiocephalic veins is correct. You will find left subclavian artery, of course it's correct. Left recurrent laryngeal nerve also you're going to find there. Then thoracic duct on the right side of the esophagus is a wrong statement, because remember, in the superior mediastinum, thoracic duct lies on the left side of the spine or the left side of the esophagus. Okay, remember this. So the answer here is D. Question number 9. Reticular fibers are collagen type 3. Remember this. There's a small video regarding the types of collagen fibers. I've attached the link in the description also. You can watch it from there. Question number 10. Which of the following muscle is supplied by the medial branch of median nerve in hand? Answer here is second lumbrical. If you want to see the detailed explanation regarding this, watch the video on the nerve supply of the intrinsic muscles of the hand, which I've made, and I've given the link in the description. You can watch it from there. Remember that median nerve in the hand supplies 5 muscles, the 3 muscles of the thenar eminence and first and second lumbrical. So out of that, the 4 muscles are innervated by the lateral division of median nerve, and the only one muscle that is innervated by the medial division of the median nerve, and that is the second lumbrical, which is the medial out of these 5 muscles. So these are the 5 intrinsic muscles of the palm innervated by the median nerve. So paper 1 part 1 is done.